Welcome everyone to the last webinar of the 2020 Summer Wellness Series, Mindfulness as a Coping Strategy in Times of Crisis, presented by Dr. Linda Carlson. We would like to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The City of Calgary is also home to Métis Nation of Alberta, Region 3. The Summer Wellness Series is presented in partnership with the Taylor Institute for Teaching and Learning and the Campus Mental Health Strategy. Please note that this webinar will be recorded and published online to be viewed after. My name is Dr. Melissa Boyce. I am the Academic Coordinator of the Embedded Certificate in Mental Wellbeing and Resilience, and I will be your moderator. With me today, I have Dr. Cheryl Jeffs, Educational Development Consultant at the Taylor Institute, who will be co-moderating the Q&A and reflection portions of the webinar. Please note that the chat box and your name display will be edited out of the final recording. Note that at any time, if you speak into your microphone, your voice will be recorded. All microphones and videos are turned off except for the facilitator and working group members, to ensure participants' webinar experience is not disrupted with other video images or sounds. There will also be time at the end of the Q&A, and we will do our best to answer as many questions as possible. Feel free to use the chat box during the presentation to ask questions and to provide reflection messages. If you would like to send a private message with a question or reflection question, Liz will type the instructions into the chat box now. At this time, I want to introduce our presenter, Dr. Linda Carlson. Linda is the Enbridge Research Chair in Psychosocial Oncology, a CIHR strategy for patient-oriented research mentorship chair. She is a full professor in psychosocial oncology in the Department of Oncology, the Cummings School of Medicine at the University of Calgary. She is the Director of Research and works as a clinical psychologist at the Department of Psychosocial Resources at the Tom Baker Cancer Center. And she has published over 200 research papers and book chapters in the area of psycho-oncology and integrative oncology, holds several millions of dollars in grant funding, and regularly presents her work at international conferences. Welcome, Linda, and over to you.
Thank you for that lovely introduction. I'm ready to take it away. So first, I'll just outline a little bit about what we're going to talk about today. So we'll begin by talking more generally about mindfulness, what it is, how do we define it, and I'm going to intersperse a number of exercises throughout the session. So we'll begin with a breathing exercise. Then I'll give you a bit of background on different mindfulness training programs, so mindfulness-based stress reduction being the most popular. I'll tell you a little bit about our mindfulness-based cancer recovery program, and really highlighting the parallels between the cancer experience and actually what we're all going through now with the whole COVID pandemic. And how these are similar and how some of the lessons learned with working with cancer patients can translate for all of us in this difficult time. I'll do a very brief summary of mindfulness research. I took out all the graphs, so really it's just going to be a bit of a summary of what we know from our own research and then some of the other research in the area. And then I'll finish with a whole session on mindfulness and stress. So the different types of stress, how we can use the mindfulness skills to really help us cope better with stressors in our life. So we'll do a stress exercise, and I'll teach you some different breath, what we call minis, that you can use throughout your day to help you cope with stress. So let's start. What is mindfulness? So there's a lot of misunderstandings and myths on what mindfulness really is. And I like to show these Time magazine covers, one from 10 years ago, one more recently. And if you just take a glance at those, you might think that, you know, mindfulness turns you into a beautiful, young, blonde woman. Of course, that would be great. But it illustrates some of these myths around this. It's serenity, you know, your mind goes clear, they all look so calm. Really, that's not the reality of mindfulness. So what is it then? We define mindfulness as paying attention on purpose in the present moment with an open and accepting attitude. I'm going to break that down for you in a minute. We think of mindfulness as a way of being in the world, so it doesn't take extra time to live your life in a more mindful way. But it's also a practice, and the practice is how we learn the capability, or we cultivate the skill of being mindful in our everyday life. So I like these cartoons, and this first one shows the way of being in the world. right? So we've got the human and their mind is all crammed full of all sorts of things, and the dog who's really just in the moment. So I always ask the question, who's more mindful, the human or the dog? And the answer here clearly is the dog, right? Because it sees what's there in the moment. And then this picture illustrates the practice of mindfulness. So here, a person is setting aside time. You don't have to sit on a cliff overlooking the ocean to practice mindfulness, but you do need to set aside a specific period of time to train the skill of mindfulness. I think of it often like learning to play the piano or learning tennis, right? You don't become a virtuoso by reading about it or just wanting to be a piano virtuoso. You have to put in the practice. And the exact same is true for the skill of mindfulness. All right, so mindfulness is about paying attention in the present moment, but if you're not doing that, what's your mind doing? And so there's a number of studies that have looked at that precise question, and it turns out we have anywhere from 50 to 70,000 different thoughts every day. And they've done studies where they give people pagers and they beep them randomly throughout the day and ask them, what are you thinking about? How are you feeling? And it turns out that about half of our thoughts are not in the present moment. And I often ask audiences, how much of our time do you think we're actually mindful? And usually they say less than half. But in some studies, they've shown about half the time we're in the present moment. The other half, our mind is all over the place. And in conjunction with that, it turns out people are happier when their attention is in the present moment. Why would that be, you might ask yourself? Well, if you're not in the present moment, where are your thoughts? So you might be like this woman. She is thinking about the past. She's ruminating. She's saying, oh, if only this or that, I should have said this, should have done that. She's feeling depressed. She's having regrets. She's ruminating. She's angry maybe. This guy, maybe you're more like him. What's he doing, right? He is worrying about the future. Oh my God, all the things I have to do, all the problems, I don't know how I'm going to cope. And he's stressing himself out. He's anxious, worried, and stressed. So when you're not in the present moment, if you're in the past ruminating or you're worrying about the future, you're causing yourself a lot of anxiety that's really just artificial. It's just a fantasy. The past is done. You don't know what the future is really going to bring. So if you can learn more to be, as we say, in the now rather than yesterday or tomorrow, you have a better chance of actually having a more pleasant experience in your life. So when we think about mindfulness academically, we break it down into 3 components. So it's called the IAA model. So the I is intention, and it really covers the why of practicing mindfulness. So in my first definition, I included it's on purpose. But for what purpose? And this is kind of your guiding motivation of practicing mindfulness. And so for some people, the intention might be, I just want to be awake and aware for my life. Other people, it might be, I want to interact better with my family. Or for the people I work with, sometimes it's just, I want to get a good night's sleep, right? Or cope with the team. So you have an intention that sort of motivates practice. Now, the core of the practice, the first A, is attention training, paying attention. And this is what you do in mindfulness. This is how you train yourself. You pay attention to a chosen aspect of your experience repeatedly until you learn how to do that. And it does take training because our minds, we call it monkey mind, they wander all over the place. That's how we've actually trained our minds through our lives. Most people to date is that our minds are jumping all over the place. And so we have to retrain it with this attention training. And then we can't forget the third aspect, the second A, which is attitude. This is really important because it's very easy to become critical when you try to pay attention or practice mindfulness because it's hard and our minds aren't used to it. And most people say, I can't do it, I'm doing it wrong, it's not for me. And so we have to apply this attitude that's kind and open and accepting to really be able to cultivate this in our lives. So I'm going to say more about these attitudes. And this is a list of some, but not all, of the sort of core attitudes in practicing mindfulness. So I maybe mentioned already non-judging. Now this is hard because we're always evaluating things around us. And the first step in non-judging is just noticing our judging, right? So even now you're like, oh, I like this talk, or, maybe I'd be better off answering emails, or, you're always evaluating and judging. And we do it to ourselves too. I'm no good at this, I suck, whatever it is, right? So noticing the judging that's constantly happening and noticing the consequence in terms of how it makes you feel, how it affects your experience. And then once we're aware of our judging, then we're able to choose whether or not it's serving us well, and perhaps judge a bit less. And the second one is patience. So again, you'll notice as I go through these attitudes that a lot of them are the exact opposite of how we are or how we're trained to be in our Western lifestyle. You know, we're fast food place, right? We want it all, we want it now. I want to relax right now, right? We're not patient. And so learning to recognize that nature has its own timeline. Red lights have their own timeline, right? You're going to be sitting there just as long, whether you're happy or whether you're miserable. So cultivating a sense of patience and willingness to just let things unfold in their own schedule. And I admit this is challenging for many people, myself included. The third one we talk about is acceptance, and acceptance is key. All these therapies, mindfulness and a number of other ones, are called acceptance-based therapies. So it's around seeing clearly what our situation is. Acceptance does not mean that you like it or you want it to stay that way or you're not going to try and change it. It's just seeing clearly and being able to accept that, you know what, right now I'm in a bad place, but that's okay. That's where I am, right? Denying it is denying your reality. So acceptance is really just yeah, it's okay. This is where I'm at. This is my experience. I see it. I can accept it and I can be with it. And the next one, letting go, is that I can let go of it, because mindfulness practice also cultivates a recognition of the certainty of change. The only certainty in life is change. And so when we cling on to things being a certain way, we cause ourselves suffering because we're unwilling to go with the flow as it is and sort of let go of needing everything to be so in control. You know, and as you think about this, as they apply to what we're going through with the COVID pandemic and all the changes in our lives and so many uncontrollable things, this identification of things we can control versus things we can't can be very helpful. And just letting go of those things we can't do anything about. Non-striving, again, is paradoxical because it turns out the only way we're ever going to achieve whatever outcome it is we're practicing mindfulness for is to kind of let go of it and to just practice simply being in the moment, right? So yeah, maybe you're practicing because you want to be a better person or you want to reach enlightenment or, you know, you want to have a better experience or relationship with your kids, say, right? You have to put that on the shelf and just do the practice and get into like actually just being in the moment. So it's non-doing, it's being. So non-striving and trust, we talk about sort of with our patients that I work with, like trusting your own intuition around your well-being and listening to that inner voice a little bit more rather than always relying on experts to tell you what to do, what to think, what to feel. So trusting yourself, trusting the practices that we're training people in, which are almost 3,000 years old. They've been around for centuries and not for no reason, right? And the last one we talk about is beginner's mind. And this is the idea of seeing things fresh, clearly, as if for the first time, you know, as if you're a child. And I often tell the story about my son when he was younger. Every spring he would be so excited and he'd come rushing up with a bouquet of these bright, beautiful yellow flowers. And mommy, look, the flowers are out. And I'd look at them and I'd be like, oh, dandelions, right? They're weeds, they're a pest. But not to him, because he just saw the beautiful yellow flowers, right? So can we apply beginner's mind to ourselves with kindness, but also to our experiences? Can we see the tree in the backyard that we've seen for the last 20 years? Can we actually look at it and see it today? Because things are constantly changing. And so people will often say to me, well, this thing's changing my entire outlook on life. And I said, well, maybe, you know, but we can begin now. And if we don't, what do we end up with? Right? So you can be a judgmental, impatient, rejecting, grasping, striving, suspicious, know-it-all. That's the opposite of these attitudes. And that's a recipe for stress. So it's kind of your choice, right? What kind of person do you want to be? What kind of experience do you want to have? Now, I mentioned at the beginning, there's a lot of myths around mindfulness and meditation. So what isn't it? It's not a relaxation practice, although it may be relaxing, it may not be. It's not a form of hypnosis or kind of mind control. It's not a religious practice, although it comes from some religious traditions and can be incorporated in any religious practice you may undertake. It's really a sort of more of an attentional practice and can be very secular. So it's not a form of prayer, it's not religious, and it's not clearing your mind of all thoughts. It's not like those women on the cover of Time magazine who look so blissful. It's not always peaceful and calm, right? Mindfulness is being aware of everything that's happening in your experience. And your experience may be tumultuous, right? Your mind may be racing. You may have fears or anxieties or sadness. And you can be mindful of all of that with those attitudes of acceptance and kindness, right? So mindfulness really is not that stereotypical person sitting in lotus position, floating on a cloud, who's blissful and has nothing going on. You may have moments of that, but really mindfulness is something you can practice throughout the day as you have your ups and downs. You can be aware of it. So why mindfulness? Well, I mentioned before, the only certainty in life is change. But our unwillingness to acknowledge and act upon the reality of change is the root cause of all suffering. We're grasping, we're pushing away, we have aversions, we have strivings. So mindfulness is one process by which we face and accept the inevitability of change. And in our programs, we like to use poetry to kind of illustrate some of these examples. So this is one of my favorite, you may be familiar with it. I went to the woods because I wished to live deliberately, confront only the essential facts of life, and see if I could not learn what it had to teach. And not when I came to die, discover that I had not lived. So that's Thoreau, right? It's about being awake for your life. You know, on their deathbed, people are often saying, geez, how did it go by so fast? What was I doing? You know, was I paying attention? So this is where we do our first exercise, where we're just going to pay attention. And we're going to pay attention to something very simple, our breath, because it's always with us. It's always coming and going, but we don't usually think about it or pay attention to it. So the first instruction here is, I don't want you to change your breath. I want you to pay attention to it. And one way we can do this is to take your hands, put one hand here on your chest, and put the other hand down on your belly. And of course, you might notice some judgmental thoughts about the size or sort of texture of your belly, and let it go, okay? So we're gonna put one hand on the belly, one hand on the chest, and if you're comfortable, let your eyes close. And we're just gonna pay attention to breath. So just notice. So notice it coming in. So maybe say to yourself, in. And then feel movement in your body. So where do you feel it? Which hand, how much? And then when it's time to breathe out, notice yourself breathing out. And so pay attention to how long each part of the breath is without judgment. So is the in breath longer or shorter than the out breath? And notice if the breath is smooth or if it comes in bits and pieces or jerks and starts. Notice the transition between in and out breath. So is there a pause? Is it a sort of smooth transition? Is there some holding? You may already notice your mind wandering. That's normal. This is what we're training ourselves not to do quite as much. So when your mind wanders with kindness, draw it back to the breath. Say, let that go. Back to just noticing in and out. So again, not trying to change the breath, just paying attention. And you may notice other things as you do this. Perhaps there's tension in your shoulders or neck or face. You may notice. Maybe you can even sense the beating of your heart. Your stomach gurgling. So consider yourself like a breath detective. What can you notice? What awareness can you have of this simple act that's constantly happening in your body? So where do you feel that movement? In the top hand, bottom hand? And as we continue to do this for a few more breaths, do you notice any changes? Okay, so now lowering your hands, opening your eyes if they were closed. Let's just take a couple of minutes to share what that experience was like. So if you want to go in your chat box and maybe just a few notes, what did you notice? So where was that movement? Was your breath long or short? You know, did it change as you paid attention? And anything else you kind of noticed about that experience? And maybe when the things come in, I'll ask Melissa to, or I think Cheryl is going to share on this one.
The first thoughts that have been posted, someone has observed small movements within their shoulders along with the breath.
That's interesting, eh? So the whole body actually participates in the breath. You may not be aware of that.
Someone is feeling more calm and felt the breath was smooth.
And does anyone comment on where there was movement in the upper or lower hand?
Not at this point. There is something about, oh yes, tummy and chest. There was more feeling there. Belly breathing. Mention about a lower hand.
Yeah, so, you know, there's an understanding among many people, you know, there's a belief that there's a good way and a bad way to breathe, right? And a lot of us have learned through our yoga classes or wherever is that we're supposed to have that deep belly breath. And that's true to a certain extent if you're trying to promote, you know, full breath, a full exchange of you know, oxygen and carbon dioxide into in and out of the body. But it's also the case that, you know, sometimes more chest breathing is appropriate for whatever activity we're doing. So we're going to actually a bit later on work it a bit at the diaphragmatic or belly breathing. But really this exercise is more about just sort of noticing what's happening with the breath. And what a lot of people notice, I don't know if anyone's commented on it, is that even though I instructed people not to change the breath, as you pay attention and just focus on the in and out, sometimes it changes on its own. And I don't know if anyone commented on that.
Not specifically. A lot of people have mentioned the calmness and also the calmness of your voice, Linda.
Yeah, and you know what? Just paying attention to the breath is calming, right? And so often what people notice is they start to feel more relaxed and their breath slows down a little bit, and it may actually balance out a bit to be more even movement in both hands. So I'm going to move on now. So here's where I plug one of my books. If you want to read more about mindfulness in a clinical setting. So it's called The Art and Science of Mindfulness. And I wrote it with Shauna Shapiro. Our second edition came out 2017. And this is more for clinicians and professionals, although anyone could read it. And it's more academic, and it's got chapters around theories of mindfulness, how to be a mindful therapist or healthcare provider, how to actually integrate mindfulness training into therapy with patients. So those are mindfulness-based therapies. And then mindfulness-influenced is just how can you have principles of mindfulness as you're working with clients. And now I'll turn to mindfulness-based stress reduction. So this program really is the foundation of all of the training, most of the training that we do in the West. And it started in 1979 by a guy named John Kabat-Zinn. And if you haven't heard of him, I really highly recommend his book. It's called Full Catastrophe Living, based on his experiences. And really what he did was he had experience actually in the East, you know, kind of 60s hippie sort of guy, and had gone and done a bunch of meditation training, and really saw a place where some of this could be, you know, stripped away of all the sort of ritualistic stuff, and just the core of it, the mindfulness training, be helpful to people in medical settings. And so he created the Mindfulness-Based Stress Reduction Program, which combines training in mindfulness with sort of stress reduction techniques and behavioral techniques that were really common at that time within psychology. And so we put it all together in this 8-week program. It's fairly standardized. Now it's been sort of manualized, and started offering it to people in Massachusetts with medical conditions who were kind of falling through the cracks. So they had chronic pain, they had anxiety, they might have had medical conditions, but all sorts of different symptoms and problems. And they would, the hard cases, and they would get referred to him. And he found this training program was remarkably helpful for these people. So he wrote this book, which first came out in 1990. And since then, the research in MBSR and what we call mindfulness-based interventions more generally has really taken off. And there are hundreds of studies showing effectiveness for a really wide range of physical and psychological disorders and symptoms. I'll summarize those in a minute. This website, amra.org, the American Mindfulness Research Association, has got all the mindfulness research on it, really comprehensive summaries. So if you're interested in that, that's the place to go. And they also compile mindfulness research studies. So what we're looking at here is a graph of the number of scientific studies published each year with the term mindfulness in academic journal article titles. So just the academic research body in mindfulness. And I often ask people, how many studies do you think last year of that nature were published? I won't go through it with you guys, but I'll get answers from 100 to 5,000, right? And this is what's happening. So this is mindfulness journal articles from 1980 to 2019. So you can see, 1980, there was very few. It was John Kabat-Zinn basically publishing his articles, but then it really took off. So our first paper was published in 2000. We started our research in 1998. There was 10 that year. So I could read every mindfulness paper that came out for many years until, 2010, we're getting up into the 100s, 200s. And so last year, I don't know if you can see the number, but it's 1,200 mindfulness articles. So now, there's such an explosion of research in this area, it's very hard to keep track of it. So really, what kind of studies are people doing, or what kind of mindfulness-based interventions or applications are out there? There's a whole host of them, and I'm just going to run through a list in case you're interested. Mindfulness-based cognitive therapy is probably the next biggest one. This was developed specifically to treat people who had depression. Mindfulness-based relapse prevention is for addictions. There's a number of adaptations for eating disorders and obesity. So eating awareness training, mindful eating, conscious living. There's mindfulness-based art therapy, which also incorporates all the benefits of art therapy in a mindfulness setting. There's childbirth and parenting. There's mindful self-compassion. So the self-compassion piece has really taken off as well. There's mindfulness at work. There's mindfulness in schools. I didn't even mention that. There's a huge research and sort of applications in that area. So one place that offers training in all these, and this is right from their website, is the University of California, San Diego Center for Mindfulness. And there's a link there. I also have one at the end. Curious to learn more about these different adaptations. So next here is just sort of a summary of the different research areas. And so they, sort of parallel the different adaptations of mindfulness. But if you look in mental health, and these are the academic studies, they have been applied to people with depression. First, it was people who had recovered from depression to prevent relapse, but now it's actually part of treatment for depression in combination with other therapies, anxiety, trauma, bipolar, social phobias, eating disorders, personality disorders, kind of you name it. There's been mindfulness applications for it. And then in physical health, which is more the area I'm in, again, people with almost every disorder have been tested in these mindfulness-based interventions. So it's effective for decreasing blood pressure and hypertension, helping to control what's happening with immune function in people with AIDS and HIV. The area I work in, cancer, there's a lot of research now. Other symptoms like hot flashes, irritable bowel, there's a strong research, pain, asthma, diabetes, it just goes down the list. And also in healthy populations, people are really interested in kind of mechanisms of what's happening within the body with mindfulness. So looking at the effects on immune function, the effects on some cognitive skills like attention, cognition, looking at stress, recovery, and reactivity, seniors, wound healing, the whole, I actually don't have it in there, the whole neuroscience, which I'll summarize briefly, of mindfulness, looking at how it affects the brain with both putting leads on the head to look at the electrical activity, but also putting people in scanners to look at what's happening with the structure and function within the brain. So I'm going to shift and talk a bit about our program of mindfulness for cancer patients, survivors, and families. I'm going to have to zoom through this, I think. So why would you think that mindfulness might be helpful for cancer patients? And this cartoon really illustrates the core issue here. My life's a mess, doc. You got to help me. I just seem to be spinning out of control, says the spider to the psychiatrist, right? So that's loss of control is such a huge element in the illness experience. And really, I'd like to make the parallel here between what we're all going through with the pandemic now, right? Is this sense of loss of control in that you don't know, what's happening in your body with this illness, or you don't know what's happening out there, or, how to decrease your susceptibility to it. It's serious business. It's a life threat, right, to your mortality. Cancer, as well as catching COVID, can be very serious. And then there's this loss of predictability and routine. All of a sudden, you don't know what's going on. The rules are changing. How are you supposed to behave? The same for the cancer patients, right? They don't know what their treatment is. They don't know what their prognosis is. The future becomes very frightening and uncertain. And there's feelings like fear, anger, grief, depression, just like there is with the threat of COVID. And with the cancer patients, they're also dealing with symptoms of illness like pain, fatigue, insomnia. And then once treatment is finished, there's always a fear of recurrence, right? What if it comes back? Well, it turns out that a lot of the skills you learn through mindfulness practice, emotion regulation, and the attitudes of acceptance, non-attachment, self-compassion are really, really helpful in dealing with these elements of loss of control, of uncertainty, of sort of accepting things as they are and letting go of, the need to try and control things. So this is just a group of patients doing our mindfulness-based cancer recovery program. And I think I'll go through this pretty quickly, but our program started in 1996, or the roots of it, with some of my colleagues based on their yoga and meditation personal practices they wanted to share with patients. And I arrived in 1997, knew about John Kabat-Zinn and his program. And so we adapted his model in 1998 and started our program, which has been open to cancer patients and family members ever since then. And it's done in groups of 15 to 20 people, as MBSR typically is. Our group is open to patients and family members. And so we run anywhere from 3 to 9 groups a year. We've had over 3,000 participants that way. And we have an ongoing clinical program with research embedded. So the program started as 8 weeks, now it's 9 weeks, about 2-hour weekly meetings. There's usually 2 instructors. And the format is a discussion. So we talk about home practice, we talk about some of the theoretical things. And we do always some movement or yoga practices and some meditation practices. And there's a booklet, and people are encouraged to do daily home practice to really develop the skill of mindfulness. They keep track of their homework, and we have a 6-hour silent retreat. The components in these programs, and ours is really no different than any other mindfulness-based programs. The overarching theme is mindfulness and all different ways that we can cultivate it and bring it into our lives. We do teach about how to relax the body using abdominal breathing. There's that element of yoga and mindful movement. We teach people about the mind-body connection and how to tap into that using things like visualization and imagery. There's a cognitive component where we talk about cognitive coping strategies and how it's our interpretations and appraisals that affect the way we feel. And there's an element of personal empowerment. And again, if you hark back to that, oh, there's nothing I can do, this loss of control, this actually gives people skills that they can apply in these situations so they feel a sense of empowerment. And there's the element of social support because it's done as a group. So these are sort of breaking down the different themes. We do an introduction to mindfulness. We spend a lot of time talking about the attitudes. In addition to these sort of teaching components, every session has a movement and a meditation to go with it. We talk about stress responding versus reacting under the heading of mind, body, wisdom, and healing. And we're going to talk about that here. We do some balance in the nervous system using breathing, which I'll take you through. We spend quite a bit of time on coping strategies, using imagery to cultivate beneficial states of heart and mind. We work at sort of deepening and expanding our practice. And then talking about, okay, after this structured program, how are you going to keep up the mindfulness? Because it's more challenging when you're on your own. So these are the types of meditation practices we train people in. So the body scan, you see them on the right side there, they're all just lying there. They're very busy. They're doing body scans, which is sort of taking your awareness from your toes very slowly through each part of the body, just checking in and really training yourself in the capacity to direct attention where you care to. Sitting meditation, you see the fellow in the chair. You don't have to sit like a guru and, with your leg wrapped around your head. Often our sitting meditation is just in a chair like that. We do walking meditation practice, open awareness. We do mountain and lake imagery often to cultivate qualities that are conducive to mindfulness practice. And we do loving kindness, which I won't have a chance to talk about much today, but cultivating compassion and kindness for ourselves and others is part of the program. And I mentioned the yoga. So we think of it as mindful movement, and the embodiment of the practice is also really quite important in these programs. All right, so I'll summarize the research results briefly for you, just to give you a sense of, some of the sorts of things we've looked at and some of the results we found. So we started out looking at symptoms in patients and saw actually our very first study, we were shocked at the size of the magnitude of the effect, where we looked at stress symptoms and things like mood, anger, anxiety, depression, and saw like 65% reduction in mood disturbance in these cancer patients. Yeah, it was really a huge effect. And more than we see in lots of other interventions. And so at that point, that was back in 1998, we kind of knew we were onto something and just continued sort of pursuing it and looked at outcomes like sleep and fatigue, things that really are bothersome for people, and showed improvements in those areas too. And so then we looked at the mechanisms, what's happening as they do the mindfulness training to decrease these symptoms. And sure enough, they're ruminating less about the past, they're worrying less about the future. And we've looked at the partners who participate and they also improve. And then we moved beyond just looking at symptom reduction to look at actually enhancing psychological well-being. And so improving overall quality of life. And, we looked at this sense of spirituality, which is not religiosity, not going to church, but more about feeling a sense of connection with something larger than oneself. So a connection with others, or a community, or sort of a sense of connection with something, sort of the universal, whatever you want to call it, this sort of nature, right? And we looked at post-traumatic growth, which is, well, you might think of it as finding the silver lining, but it's really like taking a traumatic event and using it as a catalyst for change. So it really prompts people to look at what brings them meaning and purpose in life, and looking at their values and living more authentically. And so a trauma like going through cancer or like having to live through this pandemic can actually be, and for many people have said that, it's helped them kind of strip away all that excess stuff and ask themselves, what's really important to me and my family, to bring well-being. And so we do see people focusing more on those things as they go through these programs and just improving their overall tendency to be more mindful or aware in day-to-day life. And then we also take blood samples and we take saliva samples and we look at these biological functions. We look at people's blood pressure, and we have seen week to week, there's this decrease in blood pressure that happens. We've looked at stress hormones, cortisol in the saliva. And again, we see the stress hormones normalizing out. We've looked at inflammation in blood samples and cells throughout the body, and shown decreases in inflammation. And we've even looked at the level of the DNA at telomere length, and telomeres are the little strands at the end of DNA, and they're related to cell division and aging. And so people who experience stress experience decreases in their telomeres similar to older people. So it's like it's accelerated aging related to stress that you can actually measure in the DNA. And when we did that study, it was the first of its kind, and it got a lot of media attention. So I like to show some of these articles. So this one says, yoga and mindfulness practices found to assist breast cancer recovery at the cellular level. In the National Post, and this is one of the world press, it says, world first evidence suggests meditation alters cancer survivor cells. And this one always makes me laugh, from Scientific American. It says, changing our DNA through mind control. It's like, what? We're not doing mind. Anyway, so that's a whole other story of how the media takes scientific results and plays them out. But people were really interested to see that this kind of mindfulness practice actually gets in the body. And this research here summarizes how mindfulness gets in the brain. And so this is one really good review I might point you to that's looked at the kind of research they do in neuroscience is twofold, really. So they take people who've been long-term meditation practitioners and they examine their brain. So they look at structure and function related to similar people who haven't meditated, or they actually take people who go through these 8-week programs and they scan them before and after and look at changes, even in that short period of time that you can see. And so these are your maps of the brain, the inside and the outside, pointing out the different areas that change or actually increase sort of connectivity or activity. They sort of are working together better, or they're functioning a bit more in people who practice mindfulness. And the areas that they're related to tend to be attention control. So the ability to direct your attention where you want it to go. So that's areas in the brain like the anterior cingulate and the striatum, and areas in the brain that control emotion regulation. So your ability to not blow up and go crazy, when you're stimulated or provoked. So more sort of regularity of emotions, that those brain areas change. And then brain areas related to self-awareness and proprioception also change with meditation practice. So it's not just an airy-fairy kind of thing. It's actually in your body and it's in your mind. How am I doing for time? I'm running out. I was going to tell you a little bit about some of our adaptations for wider implementation. So, these in-person mindfulness programs are great, but there's a lot of barriers for people to participate in them because they're really only offered in select places, select cities. So depending on where you live, how much time you have, the cost of getting there, parking, childcare, taking time off work, And for our patients, the symptoms and side effects we're trying to treat are barriers in and of themselves. People may be immunosuppressed, and these days there's the fear of congregating in large groups or the actual inability due to constraints from the pandemic. So we created an online version of the program that we studied in a trial called ECOM. And really this was just for patients to participate from their homes, and we looked at feasibility and different outcomes. And this was 2012, so quite a while ago, but it was using this sort of WebEx kind of interface. So participants could see the instructor, that's him there, he was in California, and they could see some of the materials, and they could also see one another. And so there was different views as there are now, and they meditated along with the instructor. And what the participants told us is that even though it was online, it actually was really beneficial for them. So for example, they could conserve their energy just for the course, and it's easier on non-course days because they're already set up. For some patients who were on treatment, it was beneficial because they could do it while they were getting their treatments. And for other people, they were reluctant or hesitant about doing this. And this person says, I'm not a touchy-feely type person, but in the end, he enjoyed the sessions and it became a highlight of his week. And there were other things that are beneficial for doing things remotely. So you don't run into people that if you're in a small town. So she didn't have to worry about someone talking to other people. And they did say that the online format provided just the right amount of contact and closeness. So in summary, it's feasible, acceptable to do it online. People are satisfied. We also saw similar improvements in mood and stress and spirituality and acting with awareness. So we've partnered with this company called emindful.com, and they have commercially available online programs that are kind of real-time interactive for generally and for different focuses like sleep and pain, that sort of thing. We're doing a study with that group right now, and I'll just go through it quickly, I think, to see if we could actually use that online program to prevent, diminish, or delay the onset of chemotherapy-related side effects. And so that study is underway, and we're not sure yet if it's going to be effective, but we hope so. And we've also developed an app. So there are many mindfulness apps. It's an innovative delivery method. It's popular. It overcomes those barriers to in-person programs. There's lots of apps, but really they've never been tested, any of them. So Headspace and Calm are some you might be aware of. So we partnered with a company that has an app called Mindfulness, and this is commercially available again, I think free for certain features. We partnered with those developers because they have these things called journeys, which are 10 to 20 day structured programs that take you through training in mindfulness. And they'd already been tested. There's an audio library and different activities. And so we took our program, and that's our book we've written, Mindfulness-Based Cancer Recovery, and turned it into components that were developed into an app. So we had 5 different sessions: what is mindfulness, attitudes, et cetera, et cetera. We went into the studio, we recorded ourselves teaching those topics. And so each sort of session had a topic, a meditation that went with it, and some other kind of exercise. So we created this journey called Mindfulness-Based Cancer Survivorship. It's translated into 27 tracks that are locked sequentially, and it's a 4-week program for patients. So here I'd like you to just briefly think for a moment. We'll do 2 ways. We're gonna sort of talk a bit about stress and the stress reaction in the body. Okay, let's do it. I'll do it quickly. So maybe just close your eyes and imagine, say you're driving in your car, or if you don't drive, you're a passenger, and you're just making your way, somewhere you normally go, to the grocery store or going to work. And, you're glancing down at maybe controlling the heat or looking at your radio, and you look up, and all of a sudden in front of you, a pedestrian is right in front of your car. And so you slam on the brakes, you skid to a halt, and you just miss the pedestrian. Okay, so notice how that feels in your body. I want you to pay attention to that acute stress response and what some of the symptoms are there. So that's an acute stress response, and we've all had that sort of fight or flight where we jump into action. And now think of something that's a little more of an ongoing stressor in your life. So this could be, trying to work from home, or some conflict you might have in the workplace with a colleague, or maybe some difficulty with your kids or your spouse, or maybe you're dealing with an aging parent, or some ongoing difficulty in your life. And how, when you're coping with that, how do you feel? So how does it affect the way you feel in your body? When you're worrying about that, how does it affect the way you think, the way you interact with people? And maybe just jot down a couple of of ideas around, sort of what are these symptoms of stress is what I'm getting at. So when you're experiencing both acute stress and this sort of more chronic stress, what kind of things do you notice? And maybe I'll get Melissa to share a few of those.
So feel free to add your reflections as to your feelings into the chat when you consider those two types of situations. So physical pain is coming up as a feeling.
So pain, and what do you notice in your body? So that first example where you look up and you're about to hit the pedestrian, what happens?
Body gets tense.
Yeah, muscle tension.
Elevated heart rate, that your breath is held, that you recoil with fear, become rigid. Start to breathe into your ears, lots of tension in your shoulders. Your chest becomes tight. Tension, heartbeat are mentioned again,
Yeah, so those are great. And so those are like what we would call physical symptoms of stress, and these are kind of immediate as well as sort of the longer term ones, right? So and when we have longer term stress, you might experience things like headaches or stomach aches, but that immediate reaction, you get the sweaty palms, right? You get that fight or flight, shot of adrenaline where there's tightness and racing heart or ringing in the ears. Those are direct consequences of that stress reaction. And as we go into the more chronic stress, sometimes people attempt to cope and in ways that maybe aren't that adaptive. So things like smoking, chewing gum, teeth grinding, drinking, going for the freezer to the Haagen-Dazs, right? So there can be behavioral symptoms. And then also there may be emotional symptoms when we're experiencing the more long-term stress. So crying, edginess, anger, loneliness, these different feelings of overwhelm and powerlessness. And I'm sure you all know, right, that when you're running around, you're stressed, like, where are my keys? What am I supposed to do? You're indecisive. You have a hard time getting things done or thinking clearly. So it affects the way you function cognitively when you're experiencing stress. It also affects your sort of spiritual symptoms. So like this loss of meaning and purpose in life, loss of direction, cynicism or apathy can be related to stress. And it affects the way you relate to the people around you. So either people withdraw and they isolate themselves and they clam up, or maybe they lash out, right? So, you're intolerant or distrustful of people. I'm going to walk you very quickly through this sort of, we call it a downward spiral of reacting to stress versus how you can respond more mindfully to stress. I don't know how well you can see this, but the idea here is that there's an external stress event, right, that happens, and it could be the conflict at work, say. But the main thing is that we have this perception and appraisal. So we have to decide that it's a stressor before we have that reaction. If we decide everything's fine, it's no big deal, we're not going to have that stress response. But if we do perceive something as, overwhelming or beyond our capabilities, we'll have that internal stress response. And so that involves different glands in the body, your adrenal, pituitary glands, and you secrete different hormones and that lead to those different acute symptoms of stress, right? So you've got your increased blood pressure, your pulse is elevated, so that's your acute hyperarousal. And that's fine if it resolves. So after you just about hit the pedestrian, you take a deep breath and everything's fine, right? But with those chronic stressors, it builds and builds, and often we don't really take the time or have the ability to sort of cope with each instant. And so we call that internalization, where we just try to push it down. No, I'm okay, I can handle it, just carry on, go ahead, right? And that can lead to this dysregulation. So the symptoms there are things like chronic hyperarousal, high blood pressure, heart arrhythmias, difficulty sleeping, those headaches, anxiety that we talked about. So that's sort of your dysregulation. And then we go on to try and cope with these difficult symptoms, and often our coping is maladaptive or not helpful. Right? So that's where we do things like overworking, overeating, and turn to substances. So people are smoking, drinking, using drugs and food or caffeine. So we have the substance dependency, and then that can lead to subsequently over a long period of time, this physiological breakdown. And this is where you might get symptoms of anxiety, stress, depression, and also it's where our vulnerabilities come into play. So if you have a family history of heart disease, your vulnerability to heart disease, might be more likely to manifest, or cancer. So we're not saying that stress causes these things, but over time can contribute, to a predisposition that people may have for different mental and physical health. So that's kind of the downward spiral, we call it, right? Of all this chronic stress building up and not coping with it. But the beauty of the mindfulness, or mindfully responding to stress rather than automatically reacting, is that the mindfulness is that awareness. So we may still appraise something as stressful, and we still may have that internal stress response, but there's an awareness of it. And there's also the ability to stop and, for example, breathe, reconsider our interpretations of events, and then apply different coping strategies. So there's still the stress response, possible arousal, but this awareness of the full context and application of mindfulness that leads to more calmness and balance of mind. So I know we're running short on time, but actually we should be good to go through a little bit of an exercise about how we can control that fight or flight reaction. So first we need to understand a bit about the nervous system. And at a large scale, we break it down between the voluntary nervous system and the autonomic or automatic. And so if I decide to raise my arm, I raise it, that's a voluntary movement of my nervous system. Lots of stuff happens automatically that I don't need to think about. Right? I don't have to tell myself to breathe. I don't tell my intestines to digest. I don't tell my, glands to secrete hormones, right? All that stuff happens automatically. My heart beats, I don't have to remind it. I don't have to think every time I'm taking a breath. So those are all controlled by the autonomic nervous system. And this diagram here shows you within the autonomic nervous system what we call the two arms. So one is sympathetic. That's the fight or flight response. That's what we're just talking about. So the arousal, the heart rate, all those different muscle tension. When your sympathetic is aroused like that, that's what you experience. And so the parasympathetic, or what's more the relaxation response, is suppressed, right? And so when we can activate the parasympathetic or the relaxation response, then it quells that sympathetic fight or flight reaction. So we can balance out these arms of the autonomic nervous system. And it turns out, even though it's automatic or autonomic, we have some control over this. And it's really simple the way we have control. I normally ask people to guess, but I'm going to tell you, it's through the breath. So the breath is connected with autonomic balance. And if I were to ask you which part of the breath feels more relaxing, the in or the out, if you think about it, most people would probably say, it's the out breath, right? When the stress is gone, you take a big exhalation, and that actually physiologically stimulates the parasympathetic arm of your nervous system. And it decreases your heart rate, it decreases your blood pressure, it releases muscle tension, and a whole bunch of other things. So the exhalation is the relaxing part of the breath, and the inhalation is the arousing or the energizing part of the breath. So when you're anxious or stressed, you're kind of focused on the in-breath, like, and that builds your energy, and the exhalation decreases it. And so knowing that the exhalation is relaxing and the inhalation is more stimulating, the beauty of the breath is that even though it's automatic, you can also control it, right? It's also voluntary. And so we do a lot of exercises in our program to help people restore balance. So, if you're up like this or you're like this, however it is, you can do these exercises to get yourself more balanced, more regular. And so one that we do that's balancing, we call it riding the wave of breath. And I would like to quickly go through a few of these with you. So in this case, the first step in all these exercises is to let your breath go deeper, right? So we are focusing more on a full inhalation and exhalation. And one way to sort of feel that is to put just your hand on your belly and release the tension in the belly. And for this one, we're going to be following that wave. So as we inhale, we're going to go up, counting up to 4. And as we exhale, counting down from 4 to 1. So maybe just try it a little bit. And then you're visualizing that wave as you're doing this. And you don't want it to be forced. So it takes a bit of practice to get a comfortable, slow in-breath for the count of 4. And then counting out 4, 3, 2, 1. And then in 1, 2, 3, 4. And visualizing this very smooth wave. Okay, so open your eyes. Let's leave that one. I'm going to try a different one. This is also a balanced breath. And this might not feel as natural to you, but it's called a square breath. And here what we're doing is adding in a pause. both at the top of the breath after you breathe in. So for example, you breathe in to 4, and then there's a pause where you hold, and you can hold maybe for 2 if you want to make it more like a rectangle, or you can hold for 4, and then exhaling for 4, and then holding at the bottom of the breath. So with your lungs almost empty, not completely, but comfortably almost empty, holding, and then inhaling again and holding. So try that a few times. And again, you're still working with the fairly deep breath. And noticing as you hold at each end of the breath, how it feels. And which comes more naturally, and where there's discomfort, if there is. So I'm going to ask you at the end, what you thought of these and which ones you liked or didn't like. So let's move on to another one. So those two were balanced breaths. So there was equal emphasis on the inhale and the exhale. Now this one, remember I said the exhalation is more the relaxing part of the breath. So here we do a triangle. It's like the square that we hold, but we only hold after the out breath. So we're breathing in for 4, out for 4, and then we're just holding at the bottom of the breath with your lungs mostly empty. And so that means 2/3 of the triangle, the emphasis is on the exhalation, and 1/3 on the inhalation. So try that, counting to say 4 or 3 or whatever for each side of the triangle. So there's the in breath, which goes directly to the out breath, and then the pause just after the out breath. I just want to keep doing that one. I like it so much. All right, and we'll move on to the last one. So this is the opposite. This is what we call an invigorating triangle breath. So here, the emphasis is on the inhalation, right? So you're breathing out for 4, say, and then move right into the in breath, and then you're holding with lungs mostly full. Now, most people want to relax, but there are times when you need to wake up, right? If you're driving on the highway and you're drowsy, or you have to do some work-related thing and you just don't have the energy, maybe instead of a cup of coffee, you can do some of these invigorating breaths. So try that and see how it feels. So we're going to exhale, inhale, and then hold near the top of the breath. So give that a try. Okay, and now opening your eyes again if they were closed, and let's just take a few minutes for reflection. So of those 4, we did the wave, the square, the relaxing triangle, and then the invigorating triangle. What did you like the most, or where did you struggle? Have you done these before? Just any sort of observations or feedback on that?
You can add some of your comments into the chat feature.
Oh, in the chat box, yeah.
Chat box, yes, that's great. Someone mentioned they preferred the wave.
Mm-hmm.
Another person related aging to harder to do some of the breathing, the breaths.
Well, maybe because we're so conditioned to the way that we normally breathe. If it's quite different, than the way that you've spent most of your life breathing, it'll feel more unusual. And that's probably why the wave for some people feels more comfortable, because it's more like our normal breathing, whereas adding in the pauses might feel a little unnatural.
Yeah, and some preferring the square, some the triangle. So a bit of a mix.
Yeah, the square is challenging for people. And what I often ask people is, do you notice the difference when you're holding your breath after the out breath with your lungs mostly empty versus after the in breath?
A couple of comments about the breathing was relaxing as well.
Yeah, and when you balance out your nervous system, it is relaxing. And what a lot of this mindfulness training does is if you think about your level of sort of vibrating in the world, you know, your level of functioning, you might be fairly tense, you're kind of up here. And so it doesn't take much to have you kind of explode, right? Like a pressure cooker. So you just don't have the tolerance for a lot of, you know, sort of unexpected things. But doing these exercises, it takes your level of basal arousal like down to here, right? So you're feeling really quite calm, and then something happens, but you've got much more capacity to respond before you kind of lose it, right? So it sort of brings down that baseline level of just where you're working, and it just feels better, you know, throughout the day, not to be kind of vibrating at such a high level. So I think I'll just summarize now. So we talked about mindfulness as present moment, non-judgmental awareness, applying acceptance, and as a way of being in the world that's cultivated through practice of meditation. And there's programs like MBCR and Mindfulness-Based Cancer Recovery and many other MBIs that train people in mindfulness. And these are well documented to help decrease a range of symptoms like anxiety, stress, and depression. And through the sort of stress exercise, we showed that mindful awareness helps people cope with just everyday stressors. And there's lots of little tips and tricks that you can use. And I didn't talk too much about this, but there are online and app-based mindfulness programs that are available for people out there that can also be quite effective. So I'll end it there, and I'll turn it over to you guys to go through the resources and the Q&A.
Thank you, Linda. I did receive a private question while you were giving your presentation. And so the question related to not liking breathing out through the mouth and wondering whether the exercises still work if you breathe in and out through your nose.
Oh, I never said you were supposed to breathe out through your mouth.
Oh.
So some exercises people do, they ask you to breathe in through the nose and out through the mouth. These ones, I just do them all in and out through the nose. And in fact, if you can, you know, if there's not an obstruction or something in the nose, you should always breathe in and out through the nose and not the mouth. It's just healthier physiologically.
There was another question about the invigorating triangle caused me to yawn. Is that normal?
Yeah, potentially, because you're, depending on how you did it, you're shifting the balance of gases in your system. And so sometimes the yawn is just your body's way to kind of rebalance that. You know, and so as you continue the practice, you probably would notice that less.
There was a question about looking at apps that are available. Are there ones that are free and available to everyone?
Yeah, I mean, so Insight Timer is one that is very widely used, and it's got a lot of, I just use it for a timer for meditation, but it's got lots of guided meditations on it as well. And I'm not sure if Headspace was offering free memberships during COVID, I believe. And the AM Mindfulness also has quite a few free features, but the one I use mostly would be the Insight Timer. There are also on the resource page just previous to this, I put a website that is, it's called Free Mindfulness or something like that. And it's got a huge range of guided meditations you can just download from your computer or like onto your phone. And everything's free there, and they've compiled a big resource list. So I like to use that resource too.
Thank you. There's a comment actually about an MBI option at UCalgary.
Yeah, I actually put that on the list too.
That's great.
Yeah, so if you go back to the resource list, or you'll find it on the page prior to this, there is a continuing education course through University of Calgary. And I ran it myself for many years, and my colleague Michael Specco ran it, and now one of our other colleagues does it. And so it's offered each semester through continuing education. I know lots of employees get free courses, so you could look into that. It's running again this fall online.
Do we have any other questions for Linda? And if so, feel free to put them into the chat, or you can send them to me at number questions.
Please ask questions. I finished early, so we'd have time.
I think you were just so comprehensive. You answered everything. Okay, so that concludes the last 2020. Oh, yes, the slides will be shared. And one more question actually came in at the last second. So does holding one's breath have special meaning?
Well, it has a physiological effect, holding your breath. It's actually increases your heart rate. So it's a stress. It causes more physiological arousal, holding your breath. So I don't recommend it unless you're actually trying to sort of build up your energy level. So it'll increase your heart rate. In fact, when you're holding your breath after an inhalation, so you need to make the distinction between with lungs full versus lungs empty. Holding your breath with your lungs full after an inhalation, what most people call holding your breath, right? You breathe in and you hold. Is gonna make you feel more anxious and aroused. Whereas holding your breath with your lungs empty, once you get used to it, is actually fairly peaceful and relaxing. So it is different, yeah.
Okay, there were some additional questions that came up. And so looking at mindfully breathing while running and you getting congested, how do you manage that?
Mindfully breathing while running, what was the second part of the question?
That while running, getting a congested nose, that interferes with the ability to mindfully breathe while running.
Yeah, so it's hard to breathe just through the nose while you're running, so I know people who actually try to exercise with only nose breathing, but you have to decrease your level of intensity. So certainly, breathing through your mouth when you're running is fine. And mindful running, by the way, I'm a runner too, and I practice mindful running all the time, where I coordinate the breathing with the stepping, right? So it might be, as you're running, it's in, out, in, out, or something like that, depending on your pace. So, and I mentioned briefly mindful walking too, and really any activity is mindful if you're just paying attention, you're awake and aware as you participate in it, rather than, letting your mind daydream or wander or planning or, so when it's summer and beautiful, you're going outside, and mindfulness is not just about your internal experience, like your breathing, but also everything that's happening around you. So can you see the colors of the trees and feel the breeze and hear the sound of birds? And as you bring in more and more senses, it becomes a more immersive kind of mindful experience. So that's a really great way to practice mindfulness, even just sitting on your back deck and, closing your eyes and, okay, what do you hear? What do you smell? What do you feel on your skin, right? Those are all good mindfulness exercises.
There was a question about the different types of mindfulness, and do they do different things? And does just one have to find out what works best for them?
So maybe they mean different types of meditation practices, because there's only one type of mindfulness, but there's many different practices you can do to cultivate it. And so what I often say to people is try a variety of things and find what fits for you, and what seems to be something you like to do that makes you feel good. And it's the same for many mind-body practices. So this goes for yoga or Tai Chi or meditation. A lot of these practices have the same result of sort of getting you in touch with your body, slowing down your physiological arousal, bringing you into the moment. So really any of those practices that resonate with you that you want to do, because the hard part about these mind-body or mindfulness practices is doing them, right? Is remembering to do them and having the motivation to do them. So if there's something that you enjoy that helps you feel more connected and in the moment, then go with that, right? I think there's I always say many paths up the mountain, right?
Can you comment on the effect of mindfulness and lymphatic system drainage?
Well, that's interesting. So this is a condition in cancer patients often, when they have lymph nodes removed and they can get lymphedema or swelling or a buildup of lymph fluid. I don't think there's been any studies on that. The most research on sort of lymphatic drainage has been more around manual manipulation, like lymphatic massage and that kind of thing. But I think decreasing tension, so the mindfulness practices will decrease muscle tension throughout the body, is probably going to be helpful in terms of the pain experience associated, with lymphedema or sort of pooling of the lymph fluids. But there really isn't any good evidence to show whether or not it's beneficial.
There's a question about reducing the stigma of the practice of mindfulness. This person has a mindfulness room in their office. Any other suggestions?
Well, it's becoming really mainstream in many places. I think the level of stigma has probably decreased a lot overall, because you see so many sort of high-level famous people sort of promoting mindfulness. I think if you're trying to maybe bring it into your workplace, showing the evidence around its efficacy, like looking at some of the neuroscience studies or some of the clinical trials that, you know, show that it is evidence-based and it's a scientific sort of approach, that can help to convince a lot of people who are skeptical, who've never had the personal experience, you know, to see it as more than just kind of new age mumbo jumbo.
Do you think this practice is similar to EMDR?
So EMDR is eye movement desensitization and reprogramming, and it's a trauma-focused therapy that actually, you know, does have some elements that are similar. So EMDR has a specific techniques that's used to kind of, I don't know, shortcut your way into the sort of parts of your brain that similar parts that are related to mindfulness. So I think there are some similarities. The technique is a little bit different, but I think, you know, what the outcome is maybe fairly similar. I don't know of any research that's really compared the two, you know, for treating trauma or anything like that, but it'd be an interesting question.
There is a comment about a positive side to COVID and how this, it has made this person more aware of what is around them and their surroundings.
I think so, you know, and I've heard a lot of stories of sort of positives around, you know, just stripping away the complexity of our lives and all the travel and all, you know, just being at home, right? You do maybe cultivate the beginner's mind a little bit more and start to appreciate the smaller things around you, you know, and the time, maybe more time that you have with your family and, you know, spending time in the garden because you're not traveling around as much, you know. So I think, as I said, like things like the COVID pandemic, you know, that are generally seen as negative can actually have that silver lining or lead to that post-traumatic growth where people are, you know, starting to look more closely at really what brings me joy in my life. And, you know, if there's that life threat, you know, maybe not as much with COVID for many people, but when we think about, you know, something could happen to foreshorten our time on this planet at any time to anybody, you know, will I feel like I've lived my best life, right? And so that leads many people to think about, well, what do I value? You know, what is important to me? If I were to pass away, you know, in the near future, what would my regrets be? So it's not bad to look at those kind of things. And I think if COVID is prompting more people to do that, that's probably a good thing.
We've had a number of observations about liking being home, finding these sessions to be the wellness series to be really helpful, and how yoga has been helpful as well. We are reaching the end of the webinar. It's approaching 11:45. So I am going to wrap it up. This concludes the last 2020 Summer Wellness Series webinar on behalf of the Taylor Institute of Teaching and Learning and the Campus Mental Health Strategy. I want to thank all of the participants who joined us today, and a big thank you to Linda for facilitating such a great webinar.
It was great fun. Thank you.
The recording of this webinar will be available on the Taylor Institute website. The facilitator slides will be sent out and shared afterwards. For more information about upcoming Taylor Institute online events like Teaching Days 2020, visit taylorinstitute.ucalgary.ca/teaching-days. Thank you again, Linda, for being with us today, and have a great afternoon, everyone.